Hello friends, as always, we are with you on the Healthy Movement channel. My name is Maxim Mancher. I am a specialist in physical rehabilitation and physical therapy and co-founder of the network of centers, Healthy Movement. In our centers, we help to get rid of hernias, protrusions, scoliosis, headaches, high blood pressure, and other diseases of the musculoskeletal system. Today we're going to look at a very interesting topic. I will show you 5 golden exercises if you have back pain. If there is no pain, then this complex can be performed as a preventive measure. So tune in, grab a mat if you have one at home, and repeat after me. Here we go. Why are these 5 exercises called the gold standard? Because all our patients do them as a warm-up before the main work. By the way, for those of you who don't know, we have centers in Europe and Dubai. If you are interested, please contact us. We will do our best to help you. I will leave all the contacts below the video. And now let's begin. So, for whom are these exercises suitable? For those people who have chronic lower back pain, exacerbations in the lower back, acute hernias, and pain shooting into the leg, this is what is called sciatica, inflammation of the sciatic nerve. Also, for those who have pain between the shoulder blades, headaches, and neck pain. So right now, find some space at home and repeat after me. So the first exercise, cat dog. I think many of you know it. Just follow me technically. We get into this position. What are we doing? Our backs are bent as far up as possible. Our heads are down as far as possible. And exactly the opposite. I bend my back down, lift my head, and exhale. If there is acute pain, we take our time and do it to the best of our abilities. Again, up, stretching as far as possible. Down. Back up. Head down. And exactly the opposite. The amplitude should be as high as possible. I rounded my back and felt the lower back, cervical spine, and thoracic spine stretching. On the contrary, I slowly lift my head and exhale. Four, and stretch out. 5, and up. 6, and up. 7, stretch. 8. Let me remind you that this is a universal warm-up. It is suitable for almost everyone. It has no contraindications. And 10. If you have knee osteoarthritis, you can simply put something softer under your knees to make it more comfortable. 11. 12. 13. If the range of motion allows, you can increase it. Amplitude is how much we can stretch up and down. 15, and 5 more times. I can increase the tempo. 3, 4, and 5. Be sure to rest for 20 seconds between exercises. For those who didn't do 20 times, you can do 30 or 40 times, and you must take 1 sip of water between exercises. Because the breathing will be specific, the body will always require a sip of water, but not get too full, because there will be more exercises. The second exercise is very important for those who have low back pain and sciatic nerve inflammation. What do we do? The right leg is stretched back. The left arm is stretched forward. Accordingly, the left leg is bent at the knee. The left arm is stretched, the right arm is on the elbow. And I relax my neck. 1. I sit down on my left buttock. I changed it exactly the other way around and sat down on the right buttock. I switched. I can feel the glutes muscle stretching, the psoas muscle stretching, which is located here. The pace is not high. Four. 5. 6. 7. 8. Breathing is necessary so that the pressure does not rise, because we can strain during the exercises. Accordingly, the general pressure can rise. And we remove it by breathing. 10. We do 20 repetitions in total. 11. 12. 13. 14. 15, and 5 more times. I can increase the pace if I feel it's getting easier. Three more. That's enough. We rest for 20 seconds, drink water, and then restore our breathing. The third exercise is called pumping. We get into this position, knees a little wider, and stretch back as far as possible with the lower back. Back and forth in a wave-like motion. With an exhalation, whoever is in pain performs the following: backward and forward in a steady movement without bending down. Three. 4. I feel my spine from the neck to the lower back. 5. 6. Be sure to breathe. 7. For those who have difficulty, we do not collapse the pelvis. 8. 9. 10. And 10 more repetitions. 1. 2. 3. I can increase the tempo. 4. 5. 6. 7, 8, 9. That's enough. Drink some water, take 20 seconds to recover, and then proceed to the final 2 exercises. Do not skip, because these exercises are one of the most important. Let's go. The next exercise will be for the abs. Why do we need it? This is necessary so that by contracting the abdominal muscles, the antagonists of the back muscles, they will stretch. Therefore, we need to engage the abdominal muscles. Here we go. We lie on our backs, legs bent at the knees, hands under the head. We do not work with the neck. Hold the head with our hands, and when we rise, we lift only the shoulder blades with our hands. Do not lower the head like this. Here's what it looks like. I hold my head with my hands. I don't strain my neck. 3. This amplitude will be enough. 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15. 15 times is enough for those who find it difficult. If you can, go up to 20. 1, 2, 3, 4, 5. That's enough? You can immediately put your hands on your stomach while remaining in the same position and restore your breathing with diaphragmatic breathing. How to do it? The stomach is inflated. As you exhale, the stomach contracts downward. Exhales through the mouth and makes a sound. This way, we will stabilize our blood pressure after the exercise. Again. We rest for 20 seconds. You can also drink water and immediately from the same position I throw my leg over the other. This is the position for those with knee pain. You can do it with both legs at once. If there is no pain in the knees, put your foot on top of the leg, heel as close to the buttock as possible, and make a half bridge. Once, stand up. Tighten the buttocks and maximize blood flow to the lower back. 2, 3, 4, 5, 6, 7, 8, 9, and 10. I show how to do it with 2 legs. There is no need to do such a bend in the lumbar region. We come to a straight line. 2. But at the same time, our buttocks are tense. 3, 4, 5, 6, 7. Breathing is essential. 8, 9. That's it. Trust my experience, this gymnastics is the gold standard. If you have back pain, please do it. I am sure you will feel an immediate change. If so, don't forget to subscribe to the channel. Write in the comments about how much better you feel, like this video, and see you next time.
Well, it's very simple. Post-COVID, I gained a lot of weight, like I think 20% over my normal. That gave me a lot of pressure on my lower back. Developed into a sciatic nerve issues, and then basically I couldn't move for weeks. Was Googling normally, and then I found the center, came for a tryout, and here I am 2 months later, improving, building my muscles. The key thing about the center here is that they don't really focus on the problem itself. They evaluated my whole body and then started working on fixing the whole shape of my body. not only the cause of the issue, but building a stronger body to avoid any similar issues in the future. Honestly, I love it, and I think I'm going to be here for a long time. Thank you very much, and of course, all the thanks to the people here, team, physiotherapists, management, etc. Thank you very much.